I learned of it because my phone was blowing up.
Parents and spouses who care for family members say the state blindsided them after announcing they will likely no longer be paid for providing that care. The benefit was put in place during the COVID-19 pandemic as a way for families with medical needs to maintain that care and control who goes in and out of their homes. As Abby Davis reports, the Department of Health and Welfare alleges people are abusing the program.
Brian, the department says there are thousands of instances of fraud and abuse. It also claims there isn't enough money appropriated to keep up with demand.
You take this, okay, and you take this, okay, there you go. So we try to teach Brady to be actually, help as much as he can.
Brain cancer as a baby left Nathan Hill's son developmentally and physically disabled.
During brain surgery, he had a large stroke.
Now cancer-free, the 15-year-old relies on his dad for a lot of his care.
I saw it right from my head.
Nope, it's for your face.
Hill is paid for his time through the Idaho Department of Health and Welfare's pandemic-era Family Personal Care Services program.
A parent is the most loving, loyal caregiver that you can get.
Spouses also qualify for payment.
So how did you feel when you learned the department was ending the program?
Well, I felt betrayed, really.
Idaho Medicaid and Behavioral Health Deputy Director Juliette Sharon
is certainly not the outcome that we had hoped for.
Says they were left with no choice but to ask a federal agency to end the program in late January. The department cites thousands of cases of fraud and abuse.
We decided the volume was really such that we could not take appropriate oversight steps.
IDHW outlined the issues in a November letter to lawmakers, claiming people lied about when they provided care and logged more hours than the program allows, among other things. The letter also shows the program is over budget by $4 million this year because of increased enrollment and other costs. Despite that, Sharon says not all hope is lost.
We remain open to the potential to reinstate this benefit.
You'd like to, that's right.
But Hill believes it never needed to get to this point.
For every concern they have, there are effective safeguards that can be implemented.
The Federal Centers for Medicare and Medicaid Services has the final say over whether the program stays or goes. The IDHW proposed it ends on January 31st. Brian.
Okay, so Abby, if the department is open to bringing it back, would it look differently or what would it look like?
Well, Sharon says they need the support from the legislature, so working with lawmakers to come up with effective safeguards and to possibly get more money. We do know that families are meeting with a few legislators tomorrow.
All right, so it looks like it could be, handled on two fronts possibly.
Yeah.
But yeah, we kind of talked about that earlier today, Abby. Our 208 team talked to a husband who cares for his wife through that program. You can watch our coverage on our website at ktvb.com. Thanks, Abby.